Hello, today we are going to interpret the small intestinal bacterial overgrowth breath test. Our first case is a 60-year-old female who presents with bloating and chronic diarrhea. Her symptoms are exacerbated with meals in general and with fiber. A low FODMAP diet did not help very much, and FODMAPs is an acronym for fermentable oligodimonosaccharides and polyols, which are short-chain carbohydrates that bacteria can ferment, which produces gases and symptoms. Here's her SIBO test. The first thing to look at is the results boxes at the bottom for hydrogen and methane, and we can see a positive hydrogen and borderline methane result. The calculation for evaluation for hydrogen is made by taking the highest hydrogen finding among S2 to S5 and subtracting the baseline. So in her case, if you look at the chart in the middle of the page and look at the hydrogen row, you can see that the S5 sample was the highest at 37 parts per million. And if you subtract the baseline of 10, you get 27. Something to think about here is transit time. It takes approximately 90 minutes for lactulose to travel from the mouth to the large intestine in a person with normal transit. She has chronic diarrhea. If her transit is more rapid and the lactulose reaches the large intestine sooner than the expected 90 minutes, then her results may actually reflect large, not small intestine. It's not possible to know for sure what the transit time is, we can only estimate. It's also important to look at the actual collection times in the middle of the page and compare to the top of each column. The patient pretty much collected on time. She has some methane present, and even though it was less than 10, a finding of 3 to 9 may be significant in a symptomatic patient. Constipation is associated with methane, and this patient has chronic diarrhea, so methane may not be affecting this patient. Treatment for this patient involved a botanical protocol of candibactin AR and BR to eradicate SIBO. This is a botanical regimen described in the paper cited at the bottom of the screen. That study showed that the botanical regimen was as effective as the prescriptive antibiotic rifaximin for SIBO. On follow-up, the patient felt somewhat better, so another test was ordered. Here we can see that there was not much improvement between the two tests that were taken 3 months apart. In February, the hydrogen was 27, and on follow-up only dropped down to 24, which is still a positive finding. Her methane also only decreased by 2 points from 8 to 6. Take a closer look, though, at the collection schedule on the second test. She started following the schedule, but her S5 was collected at 81 minutes instead of 90, and the S6 at 101 minutes instead of 120. Being that the S5 was still within that 90-minute window, it's still a positive SIBO test. It's always important to look at the actual collection times to put things into context. Let's talk about some considerations for this case. One is that the patient did not improve much on a low FODMAPs diet. Patients with SIBO usually feel better on a low FODMAPs diet, so we wonder if there's something else going on. Further testing might include a comprehensive stool analysis to look at biomarkers that may identify the cause of her symptoms. Another consideration is that her follow-up SIBO test was not taken immediately after ending the antimicrobial treatment, so we don't know if the antimicrobial regimen was fully effective or not. If the follow-up test had been administered right after finishing the regimen and we saw these results, then we could conclude that the treatment was not effective. In that case, choosing a different treatment might be appropriate. She did feel better after the treatment, and the question is, did it actually treat the SIBO, or does she have something else going on where she benefited from the use of these herbs? It's important to look at other possible causes of diarrhea. This slide shows us a differential diagnosis of chronic diarrhea, and the list is extensive. So it's important to take a look at the whole picture and consider some of these other things like medications, infections, inflammatory bowel disease, diet. She pretty much has symptoms with any meal, so what's going on there? In her case, it would be good to look into some of these other causes. The second case is about a 70-year-old man with gas and constipation that he's had for years. He's had multiple antibiotics over the years for various reasons, like after a tick bite and dental work and other reasons. He craves carbs and he's overweight. His results were negative for hydrogen and positive for methane, as you can see in the boxes at the bottom of the page. In his case, we see an elevated baseline for methane, which is common to see with methane. Methane is associated with constipation and being overweight, both things he struggles with. The S4 sample is missing, as you can see with the break in the lines in the graph, and the NR, or non-reportable, result in the S4 box in the chart. The sample contained carbon dioxide that exceeded the acceptable limit, and that's why there's a red X in the S4 column for CO2. This compromises sample quality, so we're unable to determine the hydrogen or methane levels. The missing result doesn't really impact the methane because it was highly positive during all of the other 7 points on the test. Hydrogen is calculated by taking the highest finding among S2 to S5 and subtracting the baseline. If you look at the chart row for hydrogen, he's pretty consistent all throughout the test with low hydrogen, so it's not as likely we would have seen an elevation for hydrogen at S4. The missing sample is likely not impacting the results. I also look at the actual collection intervals, and here we see that he did collect the samples at the recommended times. The patient was prescribed Candibactin AR and BR for 2 months and a low FODMAPs diet for 3 months. On follow-up, his symptoms had improved. Here we see, similar to the last case, that even though symptoms improve, the test results were pretty much the same. The methane was exactly the same at 56. Again, like we saw in the last case, the follow-up SIBO test was not taken immediately after ending the antimicrobial treatment, so it's difficult to know if the treatment was effective. The low FODMAPs diet may have been what helped with his symptoms. A substance a lot of clinicians use for methane is high-dose allicin, which is a compound from garlic. Rifaximin plus neomycin is used for methane-positive results and has been documented as effective for methane in the literature. With any SIBO case, it's very important to treat the underlying cause. He could benefit from a prokinetic agent and magnesium to help with the constipation. Stagnation is really a great environment for overgrowth to happen, so we want to get things moving. Meal spacing can be helpful to stimulate the migrating motor complex. The migrating motor complex helps to sweep bacteria out of the small intestine and acts during a fasted state. A probiotic might be considered, however, this is controversial with SIBO. If there are prebiotics in the probiotic supplement, this can exacerbate symptoms because they're taking something that's feeding the bacteria. There's also been question about the probiotics themselves creating an overgrowth situation. There are some studies showing benefit with probiotics in SIBO. He might also benefit from a lower carbohydrate diet to help with weight loss and to help prevent SIBO, similar to a low FODMAPs diet. Feel free to contact client services with additional questions or if you need assistance setting up a MyGDX account. We also offer complimentary appointments with our medical education specialists who can answer questions related to our testing, including choosing the right test for your patient and reviewing patient test results. We look forward to hearing from you.